doesn't have to be Medicaid that we expand. It needs to be health care coverage that we expand. If our legislators choose not to use the current Medicaid system, that's okay. So the Senate had a proposal out to privatize and come up with a different plan to put together. We're willing to listen to any proposal that brings the $51 billion to the state of Florida, which is $5.1 billion a year. And by the way, we're missing the first $5.1 billion, so the clock's ticking. $5.1 billion in anybody's work world is a lot of money. There are millions of Floridians that are uncovered. This will not take care of all Floridians that are uncovered, but it will take care of a large portion of those Floridians that are uncovered, and certainly the ones that are the most needy. It is important that we realize that this is not about us. This is about all Floridians. This is about us taking a stance to say we are going to do what the law of the land calls for us to do. And whether you like the current healthcare expansion and the healthcare changes that are occurring, it is the law of the land. It has been upheld by the Supreme Court, and therefore we need to find a solution set. So from the perspective of the healthcare industry, including all the Florida Hospital Association hospitals, we are saying to the legislators, sit down with us, let's work together, let's find a solution, and let's take the money. We're sending the money to the federal government now. It's our money. We want that money back. And it's important that we realize that as the time ticks, we're allowing that money to go somewhere else. I have yet to see any of these cases in which money is saved by one state because they fail to participate, that they turn around and say, well, we'll reduce the federal deficit with that. What they do is they take that money and they give it to other states. So we want to make sure that Florida gets their share of the money. Thank you all.
Our next speaker is Bob Warlack, the President and CEO of the Greater Tampa Chamber of Commerce.
Thank you all for being here. On behalf of the Greater Tampa Chamber of Commerce and our 1,200 members, which not only represent diversity in our community, but a diversity of industry mix, we strongly encourage our state to get involved and step up and take this money. The Chamber set our 2013 legislative agenda to adopt two components related to the business climate. One, support a Florida-specific solution to healthcare reform as it relates to the implementation of the Affordable Health Care Act. And two, prevent additional Medicaid cuts. The healthcare industry in Tampa Bay is vital to the continued economic development of our region. Here in Tampa and Hillsborough County, over the last several years, we have aggressively taken the position that we are going to be proactive in improving our economy for all our citizens and everyone who counts on this economic engine here in Tampa Bay. So we need to be proactive in what we're doing. What this translates to is over 121,000 new jobs over a 10-year period for the state of Florida. Here in Tampa and Hillsborough County, it's over 7,000 jobs just for our city and county. And that's an average wage of over $50,000. That's about 50% above our average wage, significant increase. So it'll have a huge economic impact, which will have a multiplier effect throughout the economy. So we think it's vital that we be proactive, that we recognize the law of the land, as Jim said, and that we proactively work to have healthcare solutions for all of our workers. A healthy workforce is a productive workforce, which helps grow our economy. And we've taken that position that we will be aggressive to get that done. So we urge our legislative delegation and the governor to step up and act on this issue. Thank you.
Our next speaker is Professor John Petrilla, Chair of the USF Health Policy and Management Department. Please join me in welcoming professors.
Thank you. It's a pleasure to be here. I think if you strip the politics away from Medicaid, which is impossible to do, if you strip the politics away, this is simply another form of insurance. And insurance in and of itself is not a controversial notion in America. We all rely on insurance to some degree or another. And this is a major issue for the University of South Florida, which has now 47,000 students. It continues to grow. 33% of Floridians between the ages of 19 and 29 lack insurance. So this is a major issue for students trying to stay in school. It's a major issue for families trying to pay for college for their students. The university employs 13,000 people. It's a major issue for employees. And so, as Mr. Burkhardt said, whether this turns out to be Medicaid or not, the issue is expanding the number of people with insurance of one sort or another. My father was a son of immigrants. He volunteered for the Navy when he was 18. He fought in World War II as a gunner on merchant ships. He taught school for 35 years. He voted Republican, I'm sure, every election. And when he died after 3 years in a nursing home, he was a Medicaid recipient. We didn't turn away the money because he was a Republican. I don't know what we would have done for care for him or my mother, who also was in the nursing home for 6 of those months before her death without Medicaid. My father died with the clothes in his closet in the nursing home. We were about to sell my mother's house and would have had she died. So this is, in a sense, again, if you strip away the politics, this is simply about people affording health care. It's a major issue for workers. 80% of uninsured Floridians work. 60% of uninsured Floridians have family members who work full-time. So our conception of the uninsured is often very much at odds with the reality, which is in fact that most people who lack insurance work. And so that flies in the face of many of our sort of stereotypes about the uninsured. The other thing that's important, I think, to remember is that the health of people with insurance depends in large part on the health of the providers that provide care. And the Institute of Medicine, which is a nonpartisan group, just came out with a report that shows that the higher the percentage of people who lack insurance in a community, the worse health care is for people with insurance because of the impact of the lack of insurance on health providers. And so the health of a community is tied up unquestionably with the health of the healthcare sector. There's no guarantee that Tampa General will continue to exist in its present form. There is approximately, just for a couple more figures, in the states that are slated to not expand Medicaid, hospitals will receive $145 billion less nationally than they would with Medicaid, or 25% less. So the fate of hospitals, the fate of the healthcare system is largely tied, whether we like to believe it or not, to what happens with expanding the insurance space. The RAND Institute, again with a couple more facts and then I'll stop, that there will be, in 2008, uncompensated care for the insured nationally cost $56 billion, and state and local governments covered 30% of the cost. There is no such thing as free health care, regardless, again, of how we tend to think about it. And the cost of uncompensated care will simply grow. And again, if you think about trying to recruit companies to move to Florida, if you think about trying to recruit individuals to move to Florida, there's predictions that there will be an increased stratification in terms of which states have good health care and which don't, which will have a direct impact on the long-term health of that state and those communities. So I think, again, whether it turns out to be Medicaid or not, I thought Senator Negron's plan was a very creative way to try to bridge the differences between the House and the governor and the Senate. And so whether it turns out to be Medicaid expansion or not is far less important, I think, than expanding the base of people with insurance of one sort or another. And whether we like it or not, much of that will be through public sources of funding. Thanks.
Thank you, Professor. And our final speaker today, please join me in a round warm of welcome for Aaron Carr, founder and owner of Compass Care.
Good morning. There's a lot of talk these days about transparency in healthcare, so I will be transparent from the beginning. I am the little guy here. I'm honored to be involved in this group and with these healthcare visionaries, but when I was first asked to speak at this event, I must admit I was a little hesitant, and that's because I was embarrassed. I'm embarrassed that I'm a small business owner that is not able to provide healthcare insurance for my employees. And then the more I thought about it, the more I realized that's exactly why I need to be here. The little guy, this story needs to get out, how it impacts me. That is purely a financial decision for my company for the ongoing viability. And what that means to me as a business is my pool for what I can recruit from is restricted. It is limited. It's not a coincidence that the nurses on my team all have spouses who are able to have access to health care plans. So the reality really is the non-expansion of Medicaid, or some of the other speakers have already referenced, the non-expansion of insurance coverage really is the non-expansion of my business. Now you could argue, and someone could challenge me and say, well, nurses probably aren't going to be Medicaid eligible, but if you connect the dots, or if you follow the dollar, if that uninsured person shows up at the hospital provides uncompensated care, their costs are driven up, that's passed along to the insurance company. When Compass Care gets a quote and wants to provide health care insurance for their employees, that's at such an elevated level that the little guy just has a hard time competing and growing. So I think I speak for many small business owners that this is a huge issue. I also quickly want to touch on the 18 years before I started Compass Care, I was a healthcare financial consultant. So that meant I went around the country working at different healthcare organizations, looking at business ideas and initiatives, and does this make financial sense? Let's just take societal benefit out of the picture for a minute. There's just no alternative or no way I can look at this and see where it makes sense to say no to $51 billion. This is money, I think Jim pointed out, we've given a large portion of that money, and we're saying, okay, you can keep it, don't give it back to us. Wearing my MBA financial feasibility hat, that just does not make any sense to me. I don't pretend to know how to fix our healthcare system. I don't have all the answers. I do think it's about delivering timely care in the right setting. And $51 billion would be an incredible head start for that. I'd be remiss, I know we're talking about the business case today, but I am a patient advocate, and I'd be remiss if I didn't touch on my passion there. You know, we're here today overlooking the beautiful Hillsborough River, but I'm seeing and hearing heartbreaking stories every day. People that are falling between the cracks of the healthcare system. And I know $51 billion could go a long way for them. Thank you for letting me have the opportunity to speak today.